Welcome back to Life and Living. Did you know that calling 911 may be the most important thing you could do if you or a loved one has a suspected stroke? I'm here right now with Dr. Hillary Cohen, who's the Chief of Emergency Medicine at Englewood Hospital and Medical Center. Thank you for being with us today.
Thank you for having me.
We're talking about stroke today because there are a lot of things that people don't know. First is how important it is to call for help at the first sign of a stroke. Why is that so important?
Stroke is a time-dependent disease. So if you recognize a stroke early, there are things that we can do to help you. Stroke is basically you're not getting enough blood flow to your brain, and that's usually caused by a clot. Well, we have things that we can do now, such as medications and interventions, that can open that clot up. But there's a very narrow window of time where we can actually do that.
What is that window of time?
You know, generally we'll say under 3 hours. With some specific interventions and specific types of strokes, sometimes that window can be moved a little bit further, sometimes to 4.5 hours or a little bit more than that. But really, every second counts. And that's why it's so important that if you're having symptoms of a stroke, you call 911 and get to a stroke center immediately.
When that 911 call does come in, how do you assemble? What happens on the hospital end?
Well, at Englewood Hospital, we're a primary stroke center, and there are only certain hospitals that are designated as primary stroke centers. As a primary stroke center, we have a stroke team in place. This team is in place 24/7.
A stroke team? Who's on that team?
So our stroke team consists of the emergency medicine doctors and nurses, the stroke neurologist. We have a neurointerventionalists that are available 24/7 on call. We have our technicians, such as the technician that runs the CAT scan. And of course, the EMS is part of our stroke team, because they're the ones that really need to get you there and activate us and notify us as soon as possible.
Why is that team so important? Why is the cohesion between all of the healthcare providers so important?
Well, you know, when we get a call that there's a patient coming with possible stroke symptoms, and we keep a very low index of suspicion. If we think somebody may be having a stroke, we act like they're having a stroke until we're sure that they're not. But if we get that call from EMS, we assemble everybody right away. So we make sure that the doctor is there ready to meet the patient. We get the neurologist on the phone so that they're ready to come down. We get our CAT scanner available so that the minute that patient comes to that emergency department, we can get them into the CAT scanner right away. So we're sitting there waiting because, as I said, every second counts, and you know, if we waste any time, then that's time that really can affect the patient's outcome.
Okay, so let's go to the other end. The patient or a family member is sitting there, and what are they looking for? What are signs that a stroke may be happening or about to happen?
So, you know, typical symptoms of a stroke could be if you see that one side of the face is drooping, if somebody has focal weakness, meaning they can't move an arm, they can't move a leg, they can't move one side of the body, problems with speech, so slurring of the speech, problems with walking. Those are all typical symptoms of a stroke.
These are not as clearly defined as, let's say, the pain down the left side of your arm. That's a clear indicator that a heart attack is coming. Is there a lot of gray in terms of the symptoms for stroke, and can that sometimes lead to patients sitting back and waiting to see what happens?
Well, you know, stroke symptoms can sometimes be very nonspecific. So sometimes people can just be having, you know, numbness to their arm. And, you know, often we'll hear patients say, you know, I wanted to see if it would go away. You know, I thought maybe it was just the way I was sitting, that I had been in a funny position, I slept on my arm wrong, and so they're waiting to see if these nonspecific symptoms would go away. So it's really one of those things where if you're having symptoms of numbness, weakness, difficulty walking, difficulty speaking, you need to get to a hospital right away to be evaluated. Because if you're not, then you know you're going to miss that window of opportunity if it happens to be a stroke.
How important is the timeline? I know you said that there's really a window of a couple hours, but is it a matter of minutes in terms of the impact the physical impact that the stroke could be having on your body? If you do want to wait the 2 minutes and see if the tingling goes away, could that be devastating?
I mean, every minute is a minute lost. Where we can potentially get blood flow to the brain. And it's similar to if you think of somebody that is you know, similar to somebody who has a heart attack and that blood flow is not pumping to their brain, well, they can get damage to their brain. The same sort of thing is happening in the stroke, except for usually it's in a focal part of the brain, so it's happening in one area of the brain, which is why we see specific symptoms. But every minute counts because the brain can't be without blood flow, because the brain can't be without oxygen.
I know there are a lot of preventive measures that we can take, but first let's just talk about how impactful stroke is in the United States right now. What's the impact on the general public in the United States from stroke?
There's over 130,000 deaths per year from stroke. It's I think the fifth leading cause of death now, according to the CDC. And, and those are just deaths. The morbidity associated with stroke, meaning the impact on somebody's life that doesn't die from their stroke, but they end up living and then they have to live with the symptoms of a stroke is enormous.
And what can some of those symptoms be?
Well, people can have persistent what we call deficits, meaning persistent weakness of one side of their body, persistent difficulty walking or speaking.
Aphasia?
Yes.
Aphasia? Can
yes.
aphasia be an impact of stroke? I know that's a language disorder where the ability to think is there, but the ability to communicate is challenged.
Right. So sometimes people can understand and they can't get the words out. Mm-hmm. Sometimes they can't understand and the words are coming out not correctly. Sometimes they just aren't able to form the words.
Now, in terms of prevention, what can we do?
Well, everybody should be seeing their provider regularly because the number one thing that somebody can do is prevent a stroke. And to prevent a stroke, you need to do the basic things that your healthcare provider generally tells you to do, which is to take care of yourself. Make sure you're getting your blood pressure checked, on a yearly basis, and you're being evaluated because if you have hypertension, that's going to be one of the primary risk factors for a stroke, and that can be controlled with diet, exercise, and medication. If you have high cholesterol, once again, that's a major risk factor for a stroke. If you smoke, you need to stop smoking because smoking is a major risk factor for a stroke. So you need to, do the basic things that also prevent heart attacks are going to be the same things that are going to prevent a stroke.
So living a healthy lifestyle. Checkups, are checkups important? Can stroke be screened before they happen?
So it's very difficult to screen for a stroke before it happens. Sometimes people will have, some what we call a TIA, which is a stroke that resolves. It's not really a term that we're using very much in the medical terminology because we really, we're really treating all of these things the same now.
Well, thank you so much for coming and informing us. Our viewing audience is a little more informed.
Okay.
Thank you.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Life and Living with Joanna Gagis has been provided by Wells Fargo, Qualcare Inc., Johnson & Johnson, County College of Morris, Cohen Resnick, New Jersey Natural Gas, and by the law firm of Gibbons, P.C. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by NJ Biz, All Business, All New Jersey.